Hi, my name is Jane. I'm going to be your nurse today. Can you go ahead and tell me your full name and date of birth?
Jimmy Neutron 3705.
Hi, Jimmy. So today I'm going to be doing an HENT assessment as well as a neuro assessment. Is that okay?
Yep.
Okay, I'm going to go ahead and start with the HENT first, and so we'll start with your head. I'm checking for lumps, bumps, injuries, swelling, or lesions. Any pain or tenderness?
No.
I'm going to look at your eyes. You have sclera that's white. I don't notice any drainage, swelling, tearing, or anything like that. Is there any tenderness?
No.
Okay. And now I'm going to look at your ears, noting that they're symmetrical. There's no drainage coming from either one. And based on our conversation, you can hear me just fine. Okay. Next is nose. So I'm looking at your nose. It's symmetrical. I don't notice any drainage. And can we go ahead and do a patency check where you, yep. Okay, and I notice bilaterally your ears are patent. Now I'm going to look in your throat. I'm noting that your mucous membranes are pink and moist. You have good oral hygiene. I don't notice a foul odor, and your dentation is intact. No cavities noted. I notice you're wearing braces. Can I look under your tongue? I don't notice any lesions. Do you have any soreness in your mouth at all?
No.
I am going to pull your gums back and look at your mucous membranes. Nice and pink and moist. Okay, very good. I'm also just looking at the general appearance of your neck. It is symmetrical and no swelling is noted. No lesions, lumps, or bumps. Okay. And that concludes the HENT. Now I'm going to go ahead and move into the neuro. So you did tell me your full name. Can you tell me what year it is?
2020.
And what are we doing right now?
A neuro assessment.
And where are we right now?
At the hospital.
Okay, so you are alert and oriented ×4. And I've noticed that your consciousness is alert and you have a clear speech. Okay, so next thing I'm noticing is your strengths. So I need you to push down on the gas pedal, plantar flexion, pull back. Good. So as part of the neuro assessment, I'm also checking your cranial nerves 1 through 12. We're going to go ahead and start with 1. And I just want you to know if you can close your eyes and tell me what you smell.
Good. It's in touch.
Okay, very good. So your sense of smell is intact, and that's number 1. And then we're moving on to number 2, which are your eyes. So if we had a Snellen chart here, I would check your eye acuity. That's part of cranial nerve 2. In addition to that, I'm going to check your confrontation of your eyes, where you're just going to follow my pin line all the way in and out. So number 2 is intact. The next one we're going to check is 3, 4, and 6. So for that one, I'm going to check your pupils. So I want you to look straight ahead. I'm going to shine the light. Okay. I note that your pupils are equal, round, and reactive to light. And the last thing on that I'm going to check is accommodation. So go ahead and look at me and look at the frying pan. Look at me, look at the frying pan. So your pupils are perla. They're equal, round, reactive to light, and accommodate. The last part of 3, 4, and 6 is the 6 cardinal gases, so watch my pen. Very good. 3, 4, and 6 are intact. Next one I'm going to check is 5. So I'm going to have you go ahead and close your eyes. And when you feel my cotton ball touch your face, just say yes.
Yes. Yes. Yes. Yes.
Number 5 is intact. Next one we're checking is number 7. So for that one, I would like you to raise your eyebrows. Good. Puff your cheeks. Good. Now go ahead and smile and frown. And what I'm noticing is that all of those actions were symmetrical, so number 7 is intact. Number 8 is the next one. I just want you to say yes when you feel my fingers. It's a whisper test.
Yes.
When you hear my fingers, excuse me.
Yes.
Okay, that is number 8. Number 9 and 10 we put together. 9 is open your mouth and say ah. Okay, your uvula goes up and down, your gag reflex is intact. Go ahead and swallow. That's number 10, it's intact as well. Number 11, I'm gonna put my hands on your shoulders and I want you to shrug them. 11 is intact. Number 12 is stick your tongue out and move it side to side. So number 12 is intact as well. The next thing I'm going to check is your sensation of your arms, so go ahead and close your eyes. It'll give you a test. This is dull, this is soft, this is sharp. Just tell me what you feel.
Sharp. Dull. Soft. Soft. Sharp. Dull.
Okay, I'm going to do your lower extremities as well.
Soft. Dull. Sharp. Dull. Sharp. Soft.
Okay, good. Your sensation was intact, upper and lower extremities. The next thing I'm going to check are your deep tendon reflexes, and after that I will check your Robert test. Okay, so we're going to start with your tricep. Just leave it hang low. Good. Bicep. Brachioradialis. Okay, good. Triceps. Bicep. Brachioradialis. Good. Gonna do patella. Let's try one more time. Good. Achilles. Put your hand in my foot, your foot in my hand. Okay, good. Just moved into a plantar flexion. Good. Okay, based on that, all of your deep tendon reflexes are intact. The last thing I'm going to do is have you stand up. I want you to close your eyes. This is a balance test, also called Blomberg. 18, 19, 20. Very good. You can have a seat. Okay, based on our findings, everything comes out normal. Do you have any questions for me?
No.
Okay, thank you for your time.